Your smartphone is plugged in for 8 hours, yet the battery shows only 1% in the morning. This isn't a phone glitch. It's the daily reality for millions struggling with myalgic encephalomyelitis, often called ME/CFS.
Despite its common name, chronic fatigue syndrome, this condition is far more than just feeling really tired after a long week. It's a severe, long-term biological illness that simultaneously attacks multiple systems within the human body. We'll explore the science behind what ME/CFS does, the chain reaction that triggers it, and how people navigate life within a strict energy envelope.
Let's first dismantle the myth of just tired. Everyone knows what exhaustion feels like. If you pull an all-nighter or spend a day at an amusement park, your body feels heavy and your brain feels sluggish. For a healthy person, the solution is simple. You rest, you sleep, your body repairs itself, and you wake up refreshed.
ME/CFS doesn't work that way. The fatigue is profound and disabling, unrelated to how hard a person worked. Crucially, sleep loses its healing power. Someone with ME/CFS could sleep for 12 hours and still wake up feeling as if they haven't closed their eyes all night. Because the name chronic fatigue syndrome sounds so common, many patients have faced decades of dismissal from friends, employers, and even doctors, often told to just push through it or drink some coffee. To correct this misconception, scientists and major health bodies now prefer the full medical name, myalgic encephalomyelitis. Let's break down those Greek words because they paint a much clearer picture. Myalgic means muscle pain. Encephalo refers to the brain, and itis means inflammation. Put them together, and you see this is a neurological and systemic illness where the brain, nerves, muscles, and immune system are all experiencing a deep, ongoing biological crisis.
So, how do doctors identify this condition? There isn't a single blood test or scan. Instead, doctors must look closely at a patient's symptoms over at least 6 months. A definitive diagnosis requires 3 core symptoms plus at least 1 secondary neurological or cardiovascular symptom. The first core symptom is a massive, sudden drop in function. People experience a severe loss of their ability to do things they once took for granted, whether it's going to school, holding a job, cooking meals, or simply socializing.
The second core symptom is that unrefreshing sleep we just discussed. Sleep completely fails to restore energy.
The third and ultimate hallmark of ME/CFS is post-exertional malaise, or PEM. PEM is a severe systemic worsening of symptoms after even a tiny amount of physical or mental effort. Imagine your body has an invisible baseline. If you stay below it, your symptoms remain relatively steady. But cross that line, even by walking to the mailbox, reading a difficult textbook chapter, or having an emotional conversation, and your entire body goes into a massive tailspin.
What makes PEM particularly dangerous and confusing is that it's often delayed. A teenager with ME/CFS might attend a friend's birthday party for an hour on Tuesday and feel relatively okay, but on Wednesday afternoon or Thursday morning, anywhere from 12 to 48 hours later, the penalty hits. During a PEM crash, the patient might become completely bedridden, suffering from intense muscle aches, a sore throat, swollen lymph nodes, severe headaches, and an absolute inability to think straight. These crashes don't pass in an hour. They can drag on for days, weeks, or even months.
Alongside those 3 core symptoms, a patient must also struggle with at least one of 2 secondary symptoms. The first is cognitive impairment, which patients usually call brain fog. This feels like trying to think underwater or with a thick layer of cotton around your brain. It makes it incredibly hard to remember simple words, focus on a screen, process what someone is saying, or solve basic problems.
The second is orthostatic intolerance, or OI. This means the body literally cannot handle being upright. When a healthy person stands up, their nervous system automatically squeezes blood vessels to push blood upward against gravity, ensuring the brain gets plenty of oxygen. In a person with OI, that system fails. Blood pools in their legs and stomach, causing them to feel dizzy, lightheaded, faint, or experience a wildly racing heart whenever they try to stand up to wash dishes or wait in line.
To understand why a person with ME/CFS can't just shake it off or exercise their way out of it, we have to travel deep inside the human body to how our microscopic cells function. Every single thing you do, from blinking your eyes to memorizing a poem, requires energy. That energy is generated by tiny power plants inside almost every cell, the mitochondria.
In a healthy body, mitochondria take the food you eat and the oxygen you breathe and convert them into a chemical fuel called ATP. Think of ATP as the universal currency of biological energy. When you sprint down a basketball court, your muscle cells rapidly burn through millions of ATP molecules.
In a person with ME/CFS, this engine room is fundamentally broken. Multiple peer-reviewed studies show their mitochondria suffer from deep structural and functional damage. They struggle to generate ATP efficiently, stalling under the slightest pressure. Because of this mitochondrial roadblock, an ME/CFS patient's body switches to anaerobic metabolism far too quickly.
Anaerobic metabolism is your body's emergency backup system when it runs out of oxygen, like during the final seconds of a heavy sprint. It provides a quick burst of energy, but it produces a massive amount of acid and cellular waste as a byproduct, making your muscles burn. Because their cellular power plants are broken, an ME/CFS patient might hit their anaerobic limit just by walking up a single flight of stairs or standing to brush their teeth. Their muscles quickly fill with lactic acid and their cells run completely out of fuel, triggering that systemic physical breakdown.
This brings us to the crucial question: why do people get ME/CFS? Medical researchers have established it's a multifactorial disease. This is a scientific way of saying it doesn't have one single cause. Instead, it occurs when a specific set of circumstances align, like a combination lock clicking into place. We can map this using a clear, three-part framework: the predisposition, the trigger, and the stuck state. First, the predisposition. Long before a person gets sick, their genetic makeup and underlying biology may set the stage. ME/CFS often runs in families, and scientists have discovered specific gene variations controlling immune cell activation and mitochondrial structure. These genes don't guarantee illness, but they make the system more fragile. There's also a clear biological sex skew. Women are diagnosed 3 to 4 times more frequently than men. Researchers believe estrogen signaling plays a role, as estrogen heavily interacts with how the body handles inflammation and immune defenses.
Next comes the trigger. A person can carry these fragile genes their entire life without ever getting sick. But then a major biological shock hits their system like a lit match thrown onto dry wood. The most common trigger is an acute pathogenic infection. Roughly 10% of people who catch certain severe viral or bacterial infections never fully recover. The virus transforms into ME/CFS. Historically, Epstein-Barr virus, which causes mononucleosis, and enteroviruses have been culprits.
In recent years, we've seen a massive surge in ME/CFS cases following the COVID-19 pandemic. A very large subset of people with long COVID actually meet the exact medical criteria for ME/CFS, proving that SARS-CoV-2 is one of the most powerful triggers discovered in modern history. Other triggers can include major physical traumas, like severe concussions or major surgeries, which can shock the central nervous system intensely enough to alter the blood-brain barrier.
Finally, we have the stuck state. When a healthy person gets a bad virus, their immune system sounds an alarm. White blood cells swarm, inflammation spikes to fight the virus, and the person feels miserable for a week. Once the virus is gone, the immune system turns off the alarm, inflammation drops, and the body returns to balance. In ME/CFS, the body gets trapped in this defense phase.
The alarm system gets jammed in the on position.
The brain's resident immune cells, called microglia, remain chronically activated. These microglia continuously pump out inflammatory chemicals directly into the brain and spinal cord, creating a state of low-grade neuroinflammation. This permanent internal fire disrupts the brain's ability to communicate with the rest of the body, leading to a self-perpetuating loop of chemical imbalances, mitochondrial failure, and nervous system instability. The body has literally forgotten how to return to a normal state of health.
What happens if a person with ME/CFS is never properly diagnosed or managed? Since there's no magic pill to cure the illness, treatment primarily involves learning how to manage your daily life to protect fragile cells. When a patient is mismanaged or forced by well-meaning but uneducated doctors, teachers, or parents to exercise their way out of it, the consequences can be incredibly severe.
First, they can experience permanent baseline drops. Every time an ME/CFS patient is pushed into a severe PEM crash, they aren't just suffering for a few days, they're risking permanent damage to their nervous system. Repeated crashes can permanently lower their functional capacity. A patient who started with a mild case, perhaps able to work part-time if careful, can easily be pushed into a moderate or severe state. In severe cases, patients become entirely bedridden, unable to feed themselves, and must live in pitch-black, silent rooms because their inflamed brains can no longer tolerate sensory input like light, sound, or human touch.
Second, this triggers cascading physical complications across the entire body. The nervous system can become so sensitive that normal, everyday inputs become painful, a condition called sensory allodynia. A light breeze against the skin can feel like boiling water, and a normal speaking voice can sound like a jackhammer. The gastrointestinal system can also shut down. Because the autonomic nervous system controls digestion, its breakdown can cause the stomach to stop moving food efficiently, leading to extreme nausea, malnutrition, and severe weight loss.
Furthermore, because patients are forced into long periods of lying down to avoid crashes, their heart muscles can naturally weaken and shrink over time, making it even harder for their bodies to pump blood when they eventually try to sit up.
Finally, there's a devastating human toll. Living with a body that feels like a prison, combined with a lack of support from a world that frequently says your illness is all in your head, takes a massive psychological toll. ME/CFS patients suffer from incredibly high rates of reactive depression and anxiety. Data shows they face a drastically elevated risk of suicide, driven by pure physical suffering and medical neglect.
If there's no cure and standard exercise is dangerous, how do people manage this condition? The answer lies in a highly disciplined lifestyle framework known as pacing. Pacing is the art of treating your daily energy like a finite amount of money in a bank account. If you only have $10 to spend today, you can't buy a $12 item or you'll overdraw your account and face a massive penalty. To practice pacing successfully, patients use specialized behavioral tools. One common method is heart rate-dependent pacing. To prevent cells from slipping into dangerous anaerobic metabolism, many patients wear smartwatches or chest strap heart rate monitors. They calculate their precise anaerobic threshold using clinical formulas. A common guideline is to keep the heart rate below 60% of their theoretical maximum, which is calculated by taking 220, subtracting their age, and multiplying that number by 0.6. If an ME/CFS patient stands to walk to the kitchen and sees their heart rate spike past their threshold, they must immediately lie flat on the floor, regardless of what they're doing, to force their nervous system to calm down and protect their mitochondria.
Patients also use the 50% rule. They evaluate how much energy they think they have each morning and then deliberately choose to use only half of it.
The remaining 50% is left untouched as an emergency structural reserve to help their immune and cellular systems rest and slowly rebuild. They also practice something called radical rest. Unlike scrolling through social media or watching TV, which healthy people view as relaxation, mental and visual processing consumes vast amounts of brain glucose and energy. True pacing requires lying completely flat in a silent, dark room with eyes closed, doing absolutely nothing for scheduled intervals throughout the day.
To fight off the dizziness of orthostatic intolerance, patients modify their physical environments. They embrace a seated lifestyle, using shower chairs, sitting on a stool to brush their teeth, and using rolling chairs to move around their kitchens. They use vascular support, like tight medical-grade compression stockings or abdominal binders that mechanically squeeze their lower body, helping force blood back up to the brain. They also consume large quantities of salt tablets and electrolyte solutions alongside liters of water to artificially pump up their blood volume.
If you suspect you or someone you love has ME/CFS, it's vital to approach the situation with an organized, step-by-step plan. The absolute first step is to stop trying to force a cure through exertion. Drop any plans to exercise your way out of the problem. If you're dealing with true ME/CFS, joining a gym or pushing through a long run will cause structural harm. Embrace pacing immediately and listen to your body's boundaries.
Second, keep a comprehensive symptom log. Spend a month keeping a daily journal. Note down exactly what you did each day, how you slept, how you felt upon waking, any symptoms that appeared 24 to 48 hours later to track potential PEM, and your heart rate when lying down versus standing up.
Third, work through the rule-out list with a doctor. When you schedule an appointment with a primary care physician, remember, your main goal is to look for treatable lookalikes. Because so many diseases mimic ME/CFS, your doctor will need to run an extensive panel of blood tests and studies to check for other issues. They'll need to look for hormonal and endocrine disorders like hypothyroidism or Addison's disease. They should check for nutritional deficiencies like a severe lack of vitamin B12, folate, vitamin D3, or ferritin. They must screen for autoimmune disorders like lupus, rheumatoid arthritis, or Sjogren's syndrome. And they should order a formal sleep study to rule out obstructive sleep apnea. If your doctor discovers you actually have severe anemia or an underactive thyroid, that's fantastic news, because those conditions have direct, highly effective medical treatments that can resolve your fatigue completely.
Fourth, advocate for yourself using modern medical guidelines. If all those tests come back completely clean and normal, yet you're still experiencing delayed crashes, unrefreshing sleep, and profound exhaustion, it's time to discuss ME/CFS directly. Bring a copy of the official CDC clinical diagnostic criteria or the current NICE guidelines to your doctor. Focus your language on your loss of function rather than just saying you're tired. Explain clearly how a small task on Monday prevents you from standing up on Wednesday. If your current physician is dismissive or tells you to just try exercising more, protect your health and seek out a referral to a neurologist, immunologist, or a specialized complex chronic illness clinic.
At the end of the day, myalgic encephalomyelitis, or chronic fatigue syndrome, is not a psychological weakness, a lack of willpower, or an imaginary complaint. It's a devastating, multi-system biological crisis occurring at the cellular level. While the global scientific community continues to race toward finding definitive biomarkers and targeted pharmaceutical cures, greatly accelerated by our growing understanding of long COVID, the most powerful tool we have right now is education and validation. By recognizing the signature pattern of post-exertional malaise, respecting the boundaries of the cellular energy envelope, and treating patients with deep empathy instead of skepticism, we can transform the world into a safer, more supportive place for those waiting for their biological batteries to finally recharge.
If you found this discussion insightful, consider sharing it with someone who might benefit from understanding ME/CFS.